The number of cases we're recording in this country really just off the charts. We passed the 100,000 daily new cases milestone just yesterday, and this peak is really so much bigger than anything we saw over the summer or back in the spring. These data come from the COVID tracking project, showing 116,000 new cases yesterday. They track on a state basis, while Johns Hopkins, which is reporting 120,000, reports from counties. But any way you look at it, we are going in the wrong direction headed into the colder months. If you look at the total cumulative cases in the United States, we're up at 9.6 million now, quickly approaching 10 million. On this pace, we will hit 10 million cases by Tuesday, just 4 days from now. Essentially, we've gone from about a month to add 1 million cases back in August and September to now down to 10 days it takes to add 1 million cases, guys. So that's the trajectory we're on. Now, the Biden and Harris campaign has laid out a plan for what they would do if they succeed in this election. They would take over January 20th, so it's the Trump campaign leading the response up until then, or the Trump administration. But this is the Biden-Harris plan. They've got 7 points here, and number one in their plan is improving testing and contact tracing in this country. They also say they want to produce more personal protective equipment, talking about using the Defense Production Act. Third is giving national guidance and resources to schools and small businesses. Fourth, vaccines and treatments, including a $25 billion plan for vaccine distribution and manufacturing. 5, protect high-risk groups. 6 is reestablishing the surveillance systems we have in place for the next pandemic and reestablishing our relationship with the World Health Organization. 7th are mask mandates, but they're not talking about doing this as a national mask mandate. They're talking about working with states and local governments to implement them there. Now, I've been talking with people about this plan, and Dr. Scott Gottlieb gave me some interesting feedback. Remember, he was FDA commissioner in the Trump administration a couple years ago. He calls the plan thoughtful and particularly focuses on the testing part of the plan, saying that, among other things, the intense focus on testing under Biden's plan will help us turn over more cases. Making more people aware that they have coronavirus, he says, is going to mean more of them will take precautions to limit their contagion. That's going to reduce spread. Guys?
You know, Meg, I mean, that's all well and good, but if Joe Biden succeeds in becoming president, he doesn't take office until January 20, and there could be millions more cases by then. I just observed that. Obviously, you know that as well as I do. But let me ask you about hospitalizations and deaths. How are they trending across the country as case counts go up?
They are going up as well. We now have more than 53,000 Americans in the hospital. Deaths are rising. In addition, they reported 1,200 deaths across the country yesterday, and on the 7-day average, it's rising more than 850. The good news, though, Tyler, is that the number of deaths is not anywhere near as high as it was back in the spring. There are multiple studies showing that we have gotten better at treating COVID-19. The concern is that as cases mount and hospitalizations mount, healthcare systems get overwhelmed and it gets harder to give everybody that same level of great care. So that's why the cases need to be stopped in order to get a lid on this thing.
Shepard Smith here. Thanks for watching CNBC on YouTube.